Thank you everyone for joining us for Bleeding Disorders Awareness Week for this special Zoom on getting older and exercise. We're lucky to have Abi, Haemophilia Physiotherapist, Megan, Haemophilia Nurse, both at the Alfred in Melbourne, and Zev, who has haemophilia from Melbourne as well. A few housekeeping notes. We're recording this session and we're about to go live on Facebook. If you do not want to be seen, please turn your cameras off. Also, please keep yourself on mute at all times. Our speakers are happy to answer questions at the end. If you have any questions, use the chat feature to send them through. They'll come through to me privately. And if we don't get through all the questions, we will answer them in the coming days on our website. So please just bear with me for 1 second while I go live on Facebook. And then we can start. It's buffering. It's just live streaming. Sorry, this is not something you can do earlier as well.
Hi, Gavin.
Okay.
Hello, Zen.
We're ready to go. So handing over to Abi and Megan first.
Lovely. Hi, everyone. I will go first. I've just got a few slides to jog my memory and hopefully give everyone a bit of a giggle. So I'm just going to share my screen if I can. Okie dokie. Can everyone see that?
Yep, I can.
Yep.
Okay, so for those of you that don't know me, my name is Abi Polus. I am a musculoskeletal physio in Melbourne. I work at the Alfred with adults, so anyone from 18 to, well, 18 plus. There's no off limit. My background is musculoskeletal. I have been working with the bleeding disorders group for about a decade now. I've got a special interest in rheumatological and arthritic conditions, and I've got an absolute passion for exercise. So I'm excited during Bleeding Disorders Week to be here talking. I'll get through a little bit, but then please, I welcome questions. I'm going to finish a little bit early in my time slot because I would really love some questions. So let's go. Okay, so the bad news. If we think about how our body works, cells are turning over all the time. Cells are replicating all the time. So cells are being created and cells are being lost. So being born and dying, if you like. We've got a time of a lot of cells being created as we begin our journey in life. So that 0 to 4 age group, and then that teenage age group in particular, lots of cells being created everywhere in the body. And then once we get to 25, we've got this lovely, we've got pretty much as many as we're going to get. We've got about a good 5 years in us. And then at 30, depressingly, we then start to go down. So musculoskeletally, what we're looking at here is if we look at your muscles, your muscle mass that you have is at about 30. We've got peak muscle mass, and then and this is if we continue doing the same amount of exercise through our lifetime. Peak muscle mass at 30 then begins to go down, pretty depressing. Same thing with bone mass. So those pictures, if you were to take a bone and cross section, cut it in half, you'd be looking, you don't want big holes, you want small holes, normal bone, big holes, not normal bone. That's osteoporosis, we don't want that. And yeah, by 40, we're starting to go down. And then osteoarthritis. Now, osteoarthritis is a big topic, obviously, with this community, but it's normal to have some cartilage degradation, absolutely normal. And if you were to x-ray the whole of the population above 40, most people will show some changes. But the way that I want you to consider it is, it's like grey hair. It's an age-related change, but it's not necessarily anything that's dangerous or anything to worry about or anything that's painful. If it gets to a certain threshold, then there may be issues, and then that's something to deal with. But everyone's quite scared of cartilage change. With the cartilage change, Joe, can come decreased range of movement, decreased balance, decreased proprioception, and other issues as well. Now, obviously, in the haemophilia population, there may be that time, all those timelines shift a bit. there may be loss of muscle mass and loss of bone mass a bit earlier, because particularly in the older group who didn't have access to good treatment, who were encouraged not to be active, that may occur earlier. I'm going to explain why in one sec. And the same with the osteoarthritis. We know exposure to blood products, within the joints, the toxicity of the cartilage can increase that process of arthritis. And once it begins, it's very difficult to then stop. So that's the bad news. But the good news is your body adapts to the demands that you put on it. So if you are going to be on the couch, sitting watching TV, you can be beautifully chair-shaped or lying down-shaped or whatever shaped you are on your couch, and you will adapt to that. Muscles will shorten. You don't need a lot of bone mass or strength in order to do what you want to do. If you want to go the other end, and I've got this beautiful picture up of someone who is lifting a lot of weight with some really defined muscle mass. And if you are lifting weights, you'll also have the same with bone mass as well, good range of movement. If you put those demands on your body will respond. So even though, it's that really, oopsie, we're going downhill, exercise can change it. And there are lots of studies, and it has been absolutely empirically proven, exercise can change that. So that's the exciting bit. That's the good news. So you want to combat the effects of change, of aging, and with bone, with cartilage, with muscle. Think of oil of Olay for your face that they advertise, exercise for your musculoskeletal system. So exercise increases your muscle mass. You put demand on your muscles, they will respond to it. You increase your bone stock. To get rid of some of that osteoporosis risk, it's weight-bearing exercise. The demand that you put on those bones, they will respond to it. And the other thing that it does, within all of your joints, you have synovial fluid. So what that is, that's your WD-40 that you spray on the hinges of the door to make it open and close smoothly. Same thing. As you move, the synovial fluid sweeps over the joints, lubricates the joints, and that retains your range of movement, and also the demands you're putting on it as well, your balance as well. I'm going to give you the analogy of a car, okay? Some of us have nicer cars, some of us less nice cars. Some of that is your genetics, some of that is luck, some of that is fate, whatever you want to call it. Some of us, our vintage of car may be older or newer, but what you have to do in order to keep your car running is you have to maintain it, right? It doesn't matter what you start off with. If you don't have your regular oil changes, your car checks, everything that you need in a car, and I'm by no means a mechanic, but if you don't maintain it, you're going to end up with a car that doesn't function properly. And it's exactly the same with your musculoskeletal health. Same with all of your body. You go to the dentist, you brush your teeth, you maintain your dental health. All the other things that you are doing for your health. If you have an underlying condition that you may need to take medication for, you're going to do that to maintain your health. And what you want to do is to keep your motor running, to keep yourself running. But the musculoskeletal system is different in that you need your heart, you need your brain, you need your lungs to survive. Musculoskeletal system, somewhat less vital in order to survive, but you need to consider what kind of life you want. Because what we want to do is have a body that will allow us to function as much as we want to. And that's going to differ for everyone. And I'm just going to let you read through that for a sec. So everybody is different, right? Everybody is going to have a different level of function. For some people, if they're in agony and can't pick up their grandchildren, that's going to be a problem. For others, they want to, go up Mount Everest, and we'll hear about that tomorrow night. There's so many things in between that people want to do. But the reality is nobody wants to be in pain regularly and not do the things they want to do. And there is no magic wand. It is a bit of, if you want to maintain your function, to do the things you want to do, you need to be able to have a prescription of exercise in order to allow you to do that. So the question I always get asked is, what exercise is best for haemophilia? And the honest answer is the one that you're going to do. There is no point, prescribing an exercise that you can't do because of the state of your joints, or you can't do because you don't want to, or because you don't have the equipment, or whatever it is. There's no point. We as physios, there are personal trainers and there are psychologists and there's the whole team, the medical side of things with the factor. We can work together to get you to where you need to go and where you want to be. But some of this is responsibility on you. Some of this is, you have to choose what you want to do. And the benefits of exercise, we all know. We know the mental benefits. I've hopefully told you a little bit about the physical benefits. There's social benefits. There's the cognitive benefits. They're talking now about Alzheimer's. There was an article in the paper yesterday. It was either the Sydney Morning Herald or the Age, I don't remember, but it was yesterday about the benefits of HIIT, which is the high intensity training exercises for older people. And it was really interesting because initially, when we talk about HIIT, your mind often goes to going to the gym and really big weights and lifting. But the reality is HIIT is getting your heart rate up to 90% of its capacity. So for someone, that may be going upstairs, that may be walking up a hill, that may be walking quickly. It doesn't have to be something crazy with a lot of equipment. It just needs to be you challenging yourself. And your goalpost should keep moving as you keep getting fitter. But it should be working towards a goal of what you want to be able to do and then getting yourself there to do it. So the barriers of exercise usually are, and this is what I'm hearing in my clinic, it may be different to what other people are not telling me, but I haven't got time. My job, I can't do it. I work nights, I do this, I can't do equipment, lockdown, I can't get to the gym at the moment. I can't get to the pool at the moment. That's what works best for me. And then willpower. Yeah, I'm going to do it. I'm not at the right time yet. The reality is willpower doesn't just appear. There is never a right time. Yes, we're in lockdown, but there actually is stuff we can do in lockdown. We can, get out, we can modify. I completely agree and I completely empathize that it may not be what we want to do and it may not be the best exercise we feel for us. I am really missing the gym. I can't afford the space to have the heavy weights, but there is certainly other things that I can be doing in the meantime, as an example. And the other big one, of course, is, but I have pain, particularly arthritis in our community, and it hurts when I do it. So about 80% of people with haemophilia have cited pain as the reason that they don't do exercise. And this is based on quite extensive research. But this is the literature. You don't need to read this slide at all. You don't need to read these studies at all. I've read them all. I'm here to tell you what's in them. Basically, there are lots and lots of studies that have demonstrated empirically the benefits of exercise and physiotherapy in people with haemophilia, including the effect on decreasing pain. Now, with almost every single one of these studies, when they undertook an exercise, nobody increased their pain levels. Some decreased them, some didn't. But nobody actually got more pain, and there were lots of benefits. And there was almost this time 2 years ago, there was a massive Australia-wide study on chronic pain management, particularly in osteoarthritis, which again is what our population is suffering from. And what they found is active non-pharmacological, so no drugs, are the mainstay of management. Now, that doesn't mean don't take your factor by any means. This should be just in conjunction with factor or whichever agents you may or may not be on. But the promotion of physical exercise and weight management were the two big things that were promoted. So the barrier really to exercise is you, is me, is us. Okay. My top 4 tips, I'm coming to the end here for this, but the top 4 tips are: don't stop what you're doing. I actually see a massive decline in people who retire. And often, particularly if it's a physical job, once they actually stop doing something, that's when physically they decline. Now, I'm not saying don't retire, by all means retire, but replace. Whatever you're doing physically, replace it with something else. Move the way you enjoy moving. There's no point doing something you hate. You won't maintain it. Find what you enjoy. It might be something you know. It might be something completely new. It doesn't matter at all. Find it, move with it, enjoy it. But you're never going to suddenly get motivation. You're going to have to start somewhere. And it may be that you never enjoy exercise. but it is just something you do, which comes on to the next one. All the research that's coming out at the moment is about habits. You start forming a habit. It takes 21 days to form a habit. And then it isn't a should I exercise, should I not? Because the no, I shouldn't often wins. It's the this is what I do. In the same way that I get up and I brush my teeth twice a day, this is just what I do. Then the same thing, I get up and I do my exercise, or before I finish work, when I finish work, I go and do my exercise. Whatever it is, you tie it to become a habit, and then it stops playing on your mind. Should I, shouldn't I don't want to. It's what you do. And the last one, don't increase your weight. Now, weight is a whole nother topic, and obviously weight management is difficult. But what I would do is weigh yourself now, draw your line in the sand. I'm not going above that weight. If we can get down, if you need to, that's fine. But again, this isn't going to be for everyone, and everyone is slightly different. But if weight is an issue, don't go above the weight. So we're here to help you, right? Physios can help you on that journey. And it's not just you should do this exercise, you should do that. It's, I'd like to be able to do this. What are the steps to get there? Because if you just jump in with both feet, chances are you may put yourself at risk of bleed, or you may increase your pain. We are happy. I am most happy when someone comes in and says, look, this is what I want to do. How do I get there? And incrementally, step by step with goals, we get there. And we can be, as you can see, quite tenacious. So my last slide, this was yesterday, Haemophilia or Bleeding Disorders Awareness Week. Each of us chose this is the Victoria, the Alfred physios. There's Kathy, Frankie and myself. We each chose a red piece of equipment to work on. And we also ate red cake because we are absolutely believers with moderation in everything. With that, I might get out of this screen and hand over to Megan, and then I will definitely, and I want to hear Zev too, and then questions.
Thanks, Abby. I'm sorry, I haven't got some exciting, funny slides like Abby, so I'm just going to talk. You'll have to look at my ugly face. And I'm suffering cabin fever, living in COVID Melbourne. I'm just about over it. So if I've got grumpy face, that's why. As we all know, exercise is very important. It's important for cardiac health. It's important to keep fit if you want to work, if you've got grandchildren and you want to enjoy life. And it's very good for mental health, which is what we are noticing at the moment. You need your mental health. It's also important when you have haemophilia that we see people that are fit have very good vein health. Their veins are more elastic, they're larger, their musculature is better. Their joints are supported. They have better musculature around their joints. So they often don't bleed as much. And it is a very obvious thing that we do see. We're very lucky in our centre. We have three magnificent physios that we just could not survive without. And we work very well together. We're a centre that do use the ABDR. I don't want to hear the groans about recording, because we love recording and we use it as a clinical tool. It's not, we don't see it, I know people see it as a trial, but for us, it is a very good clinical tool because we have years of records for some of our patients. Now you can see deterioration or improvement in joint health. You can see bleeding. You can sometimes you see the sudden rush to someone's had a back injury, and then we can contact the physios. The physios contact the patient. Oh, it's all right. He started gardening, or he's ripping out the house, and he's but we get a story behind it, and it gives us a very good picture. And often people write lovely essays of what they're doing, and it really actually adds to the clinical picture and helps us look after you better. So if you can record, it's a great thing. I know the government use it for forecasting, but we really use it as a clinical tool, very valuable. And also I'm aware that probably a lot of centres don't have physios, which I'm saying we're very lucky we've got three, I'm a bit of a boast, but I know some centres don't have physio, but you can always rely on your haemophilia nurse. We know the basics, and we're not experts, but we know the basics. We also know where to get more information. Haemophilia centres in Australia are very cohesive. We all know each other and we all know who's the expert in what. We know where the physios are. So sometimes if someone doesn't have a physio in their centre, they can actually contact another centre. And a lot of physios outside speak physio talk. They all speak a very strange language. When you see them writing, it's just, hieroglyphics. But they also know where to find the people that know and can give them the help. So, for us, I would really recommend that as you get older, that you really do have an annual review with a physio, even if you don't think you're having problems. But as you get older, your eyesight declines. I mean, we notice a lot in the over 65s, people start tripping, and it's just a little trip here. It's funny when you're young, you have a fall, you sort of, oh, he fell over, ha, ha, ha. But when you're over 65, oh, we had a fall, suddenly it becomes a very dramatic thing. And with those falls, you can actually suffer, a fractured wrist, a fractured hip. And with physio, you can get the help to actually do some balance, to look at falls. And also out in the community, there's a lot of community falls and balance exercises that are run by community centres if you don't have a physio too. So you can always look for that sort of thing as well. So I'm trying to read my next thing. So it's also when you are doing your physio or your exercises, you need to sort of take into account when you're actually treating. So if you've got very vigorous exercises that you want to do, it's always good to do on a day that you're doing prophylaxis. And the closer to the time you get prophylaxis, the higher your level will be. So certainly when you're on a short acting factor, if you dose in the morning, it's good to do your exercise in the morning. With a long acting factor, you've probably got 12 to 24 hours. And certainly with the new factors coming, emicizumab, that will give you a very stable state that you probably will have more choices to when you can exercise, so that you have a stable level all the time. So there are some exciting things on the horizon for us all to have a look at, and we're all very excited to start using them. So yeah, as I say, sorry, I'm just trying to read my notes. And other things to sort of take into account as you get older, have you got ambulance? So if you fall over, make sure you've got ambulance. The NDIS scheme, the National Insurance Disability Scheme, cuts out at 65. So if you think you will need some help with mobility, that's the time to talk to your physio. They can also arrange OT. We need to get that going before you turn 65. So I suppose what I'm saying is really talk to your centres. We're all here to help. Physios are probably a very essential part of your team. Even though haemophilia is a bleeding disorder, it manifests itself as a musculoskeletal disease. So it is very important to keep in contact. I mean, I think with when you, as Abby said, you've got to start to bring exercise into your life. I mean, as you get older, you get more sedentary. You flop on the lounge as you get home. You reach for a glass of wine, and that's your day. But I think you've got to learn to give yourself cues. I mean, you hang the TheraBand off your door handle, and you can walk past it so many times, and you go, okay, I think I actually should use that. And you can have your dumbbell sitting by your chair while you watch TV. It's just those little cues that you just got to learn, as Abby said, to actually, each day do some exercise and find things that you do. I mean, we've had people that they see the physio, they go away and they went, oh, that caused a whole lot of bleeding, but I don't want to go back and see that physio. She makes me bleed. But that's the time when you do need to go back, because you need to go back and say, those exercises aren't working for me. And that's okay. The physio won't be upset. They will find another way of working with you. I mean, everyone's different. Everyone's body's different. And even what an exercise works for some person mightn't work for you. And we all want to work together to find a set of exercises that you can do, as Abby said, that you like, and that you actually get an outcome, which is what the main aim of the exercise is. So, always keep communicating, and don't get, even if you have a couple of times where you just think this isn't working, it is. And I think the physios can actually often show you that it is working. While you think it's not working, they can actually show that, you've got more flexibility, your joints are more flexible. There's a little things that so if you're feeling a bit down and don't think that it's working, get them to actually say, okay, well, how am I better? And they can say, right, well, you were like this, 6 months ago, but look at you now. Sometimes you just need those little sort of positive reinforcements to show that things are working and that you are actually improving, which it really does help. Another thing as you get older probably is getting assessments in the home. I mean, making sure there's no tripping hazards around, rugs, little dogs, that sort of thing. Vision decreases, dexterity decreases. And so it's asking for help. I mean, we're all here. We can actually help you. We can direct you. A lot of things can be done outside. Not everything has to be done at the hospital, because we're aware most of our patients don't actually live in the catchment area for the hospital. So we are able to deal with people living regionally. A lot of people, as they get older, actually move further away from the hospital. So, you know, we've probably done a lot of work recently working with regional hospitals, regional council areas to help people live and grow old in those areas as well, which has been a learning experience for us. And I think it's been quite positive for the patients as well, that they can be managed. And you know, with the new treatments, and I think as we see patients growing up and growing older, I think that the issues will be different. And it's probably so a lot of the problems that the older people have now, we probably won't see in the younger population. But I think with the older population, there's a lot more resilience. I think it's sort of safety in numbers. Sometimes it's good to have other people, you know, with haemophilia, that people understand it. I mean, to have haemophilia, we think we can empathise, but when you have haemophilia, and you often meet the young guys and they say they've never met another person with haemophilia. And I think it's great to have people that you can talk to that understand what you're going through. You know, that there are good days and there are bad days, but these people understand. So all I can say is we're here for you. We're a team. Use us. So I'll hand over to Zev.
Thank you, Zev.
Go, Zev. I'd like to say hi to David Latimer, who's in England. Is that right, David? Anyway, he's on mute. Anyway, good to see you, David. We should get in touch.
Yeah, nice to hear from you, sir.
Yeah, likewise. You see, now David is my age group. Now I'm 69 years old, and I have severe haemophilia A. And for 16 years of my life, there was no treatment, and so I would go out and kick a football with my brother in the backyard, and I'd come in after 20 minutes. My knee would be like a balloon, and I'd be in bed for 3 weeks. And there was no physio. You would just wait for 3 weeks till the bleeding stopped. So by the time, you know, I was probably 10, I had a very distinctive walk that Gavin will understand. He's got a similar one. In fact, mine's better than his. And so for 16 years of my life, there was nothing to stop a bleed. So playing sport, having an exercise regime, going for a run was just completely out of the question. So really most people who had either inhibitors or severe haemophilia that were born in the 50s or more than that or earlier than that have a distinctive walk, can't point to somebody straight, finds it hard to put a tie on. That's why we don't wear ties. So exercise right from the beginning wasn't something in our DNA. You know, if we could be competitive, we would. Contact sports were out of the question. Running was out of the question. You know, my mum didn't want me to be on a bike, so bike riding wasn't an option. So really, exercise was never a problem. And as Abi said, you know, you get to 30 and you're at your peak and you go downhill from there. Well, I would probably think that birth was our peak. and it went down from there, I think. And look, I still walk. I still play sport if I can. I used to play golf all the time. Now I don't play golf because my elbows won't allow me to. But I get in the buggy with the boys and I go around with them. And so, you know, that's important to me. But exercise is terribly important. Lucky enough to get to your old age, you end up getting into that period where, you know, people have heart attacks, people have diabetes, and there are lots of other issues that come into our lives that we have to be very concerned about. Now, I had a bad knee. To cut a long story short about my disabilities, my left knee has been fused when I was about 30. And so that's a stiff leg. So that created another interesting walk for me. And the other knee got so bad about 10, 12 years ago, I had a knee replacement done that got infected. And to cut a long story short, I had a leg amputation above knee in 2008. So I walk really strangely. I've got rid of my knee problems. I don't have any knee bleeds anymore. But exercising for me is difficult. Apart from the fact that I'll find every excuse in the book not to exercise, because our age group has that ability to know every excuse in the book to not get up and exercise. But there is a point in your life where you realise that you're not doing anybody else a favour, you're doing yourself a favour if you don't do it. So you really must find some sort of exercise program that fits you. I mean, I can't lift a dumbbell, but I can get on a bike, an exercise bike, and I just use my arms. And if I put my arms in the right position, I can drive the bike and get my cardiovascular rate up, which is fantastic. I don't have any joy walking. Walking's no joy for me, but I push myself. I find a place that is consistently flat. You know, I won't walk in the street because there's an accident waiting to happen. So if you can find some space that is flat and that you can walk in reasonably safely, you don't have to walk fast. You just increase your walk. I mean, I walk now around, there's an oval in our neighbourhood that's not grass, it's turf that's completely consistent. And I walk around the boundary and it's perfectly safe. And if I do happen to fall, which I haven't, I can get up and it's safe. I'm not in the streets. If I fall, there's grass to fall on, but it's safe. And I walk slowly and my fitness, I mean, I've never walked as much as I've walked in the last year, which is terrific. I still work every day. If you're allowed to go to the office, I still work. That's terribly important too. You know, if you can find something to do rather than sit on the couch, that's another great thing to get your motivation going and a positivity. But as Abi said, speak to somebody who knows, and a regime of exercise will work for you. You just got to find the right thing. You know, what you don't want to do is, run out there as fast as you can and, fall, have an injury. I'm talking about the older folks now. I mean, the younger blokes, they're playing footy. But the older blokes have got to modify themselves, just like in most things in life. You've got to modify your life and do what you can, do it as often as you can. And what I've always found, and even when I was young, if you can build your body mass up and if you can build your muscle tone up, it protects your joints. And if you protect your joints, you won't have a bleed, or you'll be less likely to have a bleed. And you'll just make those joints that you've got last that little bit longer. And really, it's easy to make an excuse, but at the end, you got to just, face the fact that if you don't do it, you'll suffer in the long run. The fact that there are treatments now, I mean, I'm on the new Haemophilia drug that's just now come. I don't know whether you've got it in England, David, but I've been on this program where you don't have peaks and troughs anymore with your factor eights. So my Haemophilia now gives me a consistent of about 20-25% factor eight. And my factor eight hasn't gone up, but my clotting ability is about 25% flat line. So I don't have peaks and troughs. So, I may get on the bike for 10 minutes and strain my elbow a little bit, and I give myself a couple of hours and it's gone. So really, it's wonderful times we're heading into. Younger blokes can exercise so much easier now because they've got all this coverage. But us old blokes, you've got to do as much as you can to make yourself last as long as you can, because it helps. And the big thing that I find is motivating yourself. Now, when you're on your own, you'll always find an excuse. But if you've got a mate that's also a person who has haemophilia, you go out with them and you have a regime of exercise, whether it be in the pools. And the other thing is the pool's fantastic because you don't hurt when you're in the water. You float and it's wonderful, and you can do exercises and it's terrific. If you can go with another mate who has haemophilia, and so therefore, if you cancel for some lame excuse, you're letting your mate down. So find a mate who's similar to you, in the same boat as you, go and exercise together, and you don't let yourself down, and then it becomes enjoyable. So really, there are lots of little tricks you can do to get out of exercise, but there's also some good advice to get back into exercise. So that's about it, really.
Thanks, Sev.
We're going to have an ageing issue coming up because we're all living longer, and we want to not be in a wheelchair for as long as we can. And I want to encourage Andrew Salavaggio to organise a group for us and make us buffed as he is. Thank you very much.
There you go. Andrew's going to do it, Sev.
Is he on a bike now? He's a show-off.
See? Yeah, he is.
He's a show-off.
Thank you, everyone, for that. Now, I have a couple of questions. I'm conscious of the time. So a question. Zev has talked about some of his tips about exercise. Do you have any other ideas if people don't want to go to the gym or the pool? Now, Zev to talk about walking, but is there anything else that is recommended to do?
Abby, you can talk for 2 hours.
I can. Look, something social, often dancing is something that is really popular. I have a lot of people who I would say persuaded, they may say bullied, into doing Pilates, which I know that our vision of Pilates is potentially, 20-year-old girls in light club, but the reality is that has been extremely helpful for my predominantly male population of over 30s. But it has to be personal. It has to be what you enjoy. I love, Zev, your idea of buddying up. I think that's something. Yeah. I don't think they have to have haemophilia. I just think you have to have someone that you don't let down. Doesn't matter.
Yes, correct.
Anyone. And yeah, again, it's so personal. Water is a fantastic medium for some things. It's not for others. Lots and lots of body weight stuff is excellent. So there is so much online now and so much free online that you can actually do a Google search. You can put on something and find online an instructor that you like because they're good looking, because they're funny, because they're doing what you want. Doesn't matter. But anything online, and you can go along with programs there. And there is so much out there now. For the first one, I would say don't join in with everything. Have a watch, see what you like, see what you don't like. Don't like that one, move on to the next one. Don't like that, move on to the next. I like a bit of this and I like a bit of that. And then you can winnow it down. You don't have to do everything at once. But there's a lot of online stuff. The other thing, and probably more for the younger population, but no reason why everyone can't, is all the it was the Wii Fit, it's now the Nintendo. I don't know it well, but the technology is actually that you can stand in your living room and play tennis or go bowling, whatever it is. But so long as you're moving, great. So there's a lot there. The other thing that I really advocate for, and I didn't used to, and I do now, is personal training. I love to be in touch with personal trainers. I love to talk. I don't like personal trainers that just go, do it, do it, do it. I love the personal trainers that sit down, talk to you about what you want, what your goals are, and keep modifying those goals. But if you have a personal trainer, there's a degree of not wanting to let them down. There's a degree of motivation. There's a lot of help that they can give, and you're almost accountable to them as well, which is a good thing. So that can also help, and that sometimes personal approach is very useful for some people. So there's lots of things out there, and that's again where I'd say come and talk to someone. We can look at your goals and we can work through.
Great, thank you. Another question, if while you're exercising you get a niggling pain, should you stop or push on?
Oh,
Depends,
your body.
depends where it is. If it's a big sharp pain, no. If it's that your muscles are aching a little bit, that's probably a good thing. But if you're not sure, seek help. Phone, just get on the phone, you know, what do I do? And we can work it through. We've got set questions for each bit of you and for each part of you. But I would say potentially first time, stop and seek help. We want your muscles to be a little bit sore. We don't want your joints to be sore.
And first aid like rice and, you know, Panadol, basic, you know, analgesia, things like that. If that settles, then it's probably just a niggle. But if it's ongoing, if it starts to get worse, you're getting pain at night, it's definitely starting, you're getting a bleed.
And people with bleeding disorders get the same thing that people without, like tendon issues, joint, you know, other things are normal. And use your physios. I guess the good thing is you get free physio. The only good thing is you get free physio that we can sort out all those other things as well.
Great, thank you. Recommendation for warming up and cooling down and stretching. Should I always have to do that?
Cooling down, absolutely yes. There's evidence there to show. Warming up, yes, but how much and what is actually quite contentious. There's been no studies to show it does help. However, it makes sense. If you are going to push your body to certain limits, you shouldn't suddenly go for broke, because cold muscles are going to not be happy. Cold joints are not going to be happy. So yes, you need to stretch, and yes, you need to warm up. Doesn't actually need to be very long, and it can count as part of your workout. But yes, it does need to happen. Perfect.
I think that is all for now. There's nothing, yes. Oh, all good. That was my list of questions that I had through people. So thank you very, very much for everyone for joining us. Thank you to the 3 speakers tonight. If you would like to listen to this again, it's on our Facebook page. I just got one. Can I be really quick? One more question?
Sure.
Is that all right? Any suitable exercises for a person with a fused knee?
Yeah. well, no, you do it, Abby. I mean, I'm not the perfect person to say. You just got to be careful you don't trip. It is the walking thing. I found that my stiff legs are bloody nuisance sometimes. In fact, I prefer my above the amputated leg personally. But you've just got to be careful with what you do. I mean, if you don't have any pain walking, then walking's fine. You've just got to make sure you don't trip. Again, water, being in the pool is fantastic. Walking in the pool is fantastic. Swimming in the pool is fantastic. That uses just about every muscle in your body. It's not that easy to kick with a stiff leg, but I'm sure you've tried it. But the pool would be the best thing. I mean, it's obviously no fun walking. I can understand that it's not easy walking. But upper body, you can use an exercise bike that you don't use your legs. There's no reason why you can't use weights. So, for upper body strength, that's there. There's really not much you can't really do, I think. You just got to make sure you don't trip when you're walking or trying to walk fast. Abby?
Why Zev's my poster boy, because there's nothing you can't do. There's one limb that's
I can't do most things. That's the problem.
out of action. You can use the other 3 in the rest of your body. Appreciate if one needs fused, there may be other issues, but if you're in the pool, put a kickball between your legs, use your arms if you can, or you can even scull at the side if you've got elbow issues, you're using your core. Ergo arm bikes, fantastic for getting the heart rate up. Otherwise, body weight stuff, you can be on your back, so unloading all of your limbs and using upper limbs or other leg. And you can certainly use a straight leg as well. There's no reason you can't use a straight leg if you've got no pain.
Can I just add one thing, Abby? What I feel when you get older, back issues become a problem. And I think really good core strength work is terribly important, because most of the time you're not doing things correctly, and back problems are just the most debilitating thing you can have. So if you can keep your core strength right, I think that's another exercise you should target.
I would say whoever asked that, go and talk to your friendly physios wherever you are in Australia, and we can work out a program for you.
Thank you. Okay, thank you very, very much, speakers. Thank you everyone for joining us. Have a great night. Thank you very much.
Excuse me, Natasha, can I just speak to David for one quick second? I need to get his details. So how do I do that?
Oh, you'll have to contact him directly because we're live on Facebook, so everyone.
Oh, okay. David, have you got my email address?
Yes, I think I have. So.
Okay, email me.
Roger, will do.
Bye, everyone.
Thanks,
Thank
everybody.
you.
Cheers.